Matthew Kavanagh is the Director of Center for Global Health Policy and Politics at Georgetown University, United States of America, and he now joins us for more on this. Perhaps, Matthew, to begin the conversation here, when we talk about inequality, we often talk about the coefficient between the rich and the poor, the measurement of the distance, at least, between the rich and the poor, not necessarily an erosion of poverty in and of itself. And when we often ask about how do we close the gap, the answer often is about lifting those in poverty out of poverty and not necessarily curtailing runaway wealth, which often is a function of injustice. Do we have the right approach in how we normatively frame conversations of inequality?
You know, that's a really important point, because what we're talking about here in this report, as well as the report that accompanied it that looked at pandemics, is not just is there poverty and do poor people, for example, do poorly during pandemics, but instead we're asking, does the distance between the rich and the poor matter? Does it matter when some people are able to make billions and billions of rand and dollars and others are living on almost nothing? Does that actually have an impact? And what we have found through this report and the report that's linked to it on pandemics is that actually it makes a big difference. That actually the more inequality we have, for example, the more likely a pandemic is. Countries, for example, that had higher inequality have had higher deaths from HIV.
Yeah. Can I ask
higher rates of HIV, etc.
Can I ask this? Why does that distance matter? I'm assuming we don't live in a zero-sum economy where there is a static, finite, limited resources. While it is limited, it's not static, right? That is to say, I don't assume that somebody only gets rich if somebody gets poor in a zero-sum calculus. So why does that distance matter?
It matters because it turns out it's disabling for society. It turns out that actually countries around the world that are seeing huge rates of inequality have real trouble trying to come up with universal policies, have real trouble trying to struggle to achieve stopping pandemics, for example, or addressing people's health. That gap, it's not just poverty that matters, it's actually the gap between the rich and the poor, because some people, for example, in the middle of COVID, they were fine. They were able to exit and they didn't invest in the society. And so the poor were absolutely harmed, but it's the existence of that gap that really matters.
Is the effectual relationship between pandemic, public health on the one hand, and inequality on the other hand, causation or correlative?
It's causation. We find when we dug deep that inequality causes outbreaks to become pandemics, that inequality causes pandemics, once they're there, to be longer and deeper and more disruptive. And then inequality is the result of pandemics, because some people do well. For example, some people made billions of dollars in the middle of the pandemic by selling vaccines, but only to some people. Apologies for the background. And so that inequality pandemic cycle is exactly what we find is causal, and it can be disrupted.
Yeah. How do we then break that cycle, right? South Africa has a good case study, for instance, on the provision of ARVs, antiretroviral drugs, free of charge, despite what seemed like restrictive IP restrictions around the production of generics. Once we were able to get past that, we were able to provide it. Yet the inequality coefficient of South Africa hasn't changed positively in the interceding period. It seems that though non-economic approaches can break the cycle, what are we not doing right?
So we've got a few different things that are worth unpacking. One is there's within country inequality, and there's also between country inequality. And so as we think about pandemics especially, one of the most important things is the distance between the countries that have access to, for example, COVID-19 vaccines. The fact that there was 6 months to a year between the time that folks in Europe and North America were able to get access to vaccines and that same time that folks in South Africa and India were able to get access to vaccines wasn't just harmful and painful for people living in South Africa, but it actually gave rise to the kind of Omicron and Delta variants that we saw. It created an entire world of fueled pandemics because we didn't share inequality, because we didn't actually share those vaccines equally. We could be making vaccines for COVID in South Africa. We could also be making the most cutting edge HIV medicines in South Africa. Right now, for example, there's this drug lenacapavir. It can stop HIV with 2 shots a year, and yet it's only being made in a handful of countries and not in the United States. Then we've also got to think about the within-country inequality. And as your question was asking there, when there's big inequalities within countries, what we see we're not addressing is not just the medicines, but also what we call the social determinants of health. Those are things like housing, right? Those are things like income. They're things like education. And so, for example, we know that surging social protection to young women facing HIV is as effective as medicine in many ways, right? Because it gives them the power to make choices. The same thing turned out to be true during COVID-19. So it's not just all about medicines, it's also about those social determinants of how do we address it. And more unequal societies are less effective at addressing those social determinants, no matter how many medicines or good tests they've got in a laboratory.
Yeah. Are we able to change pandemic preparedness in the global south without necessarily having to change the political economy that defines the global south?
That's a super interesting question. And I think the answer to some degree is no. That we have to actually understand that despite all of the amazing science that's happened, we have never seen the kind of ability to fight diseases with medicine that we've ever seen before. We can detect diseases in a matter of hours often, and yet we still have not just HIV, but also COVID, but also Mpox, but also Ebola. And that reality is coming from the inequality that we're seeing around the world. And so we've got to address the ways in which political economy, as you say, is coming in. For example, some countries in the world have the ability to actually address pandemics, while others are actually seeing high and rising debt. Some people are able to actually stay home during a pandemic, and others can't because they need to be out getting food. And so that's a huge crisis when it comes to actually trying to do pandemics. And we can't imagine that somehow we'll get out of that by just having more and better tests or more and better medicines.
Yeah. Matthew Kavanagh, we're going to have to leave it there. Thank you so much for your time. Really do appreciate it. Matthew Kavanagh with Center for Global Health Policy and Politics at Georgetown University.